Welcome to the deep dive. Today we're going to be talking about psychoactive drugs. But don't worry, we're not advocating for anything illicit. We're just going deep into the science behind what happens in your brain and body when you take these substances, and how intoxication works. What can make one person's experience with a drug so wildly different from someone else's, and the surprising ways these drugs get into your system. And we're talking patches, pills, and maybe even a few methods you wouldn't expect. This deep dive is all about equipping you with the facts.
Yeah, that's right. We're all about understanding, not endorsing.
Okay, so let's unpack this, starting with the basics. What exactly is intoxication?
Okay, so intoxication is basically any mental or physical change that happens because you've consumed a substance. Imagine your brain is buzzing with these tiny messengers called neurotransmitters. They're constantly relaying signals between brain cells. Now, a psychoactive drug comes into this intricate communication network, and it can either amplify those signals or completely mute them.
So they're either cranking up the volume or hitting the mute button on our brain's communication system.
Yeah, that's a great way to visualize it. And it's important to remember that we're talking about real tangible things here. Like, these substances are interacting with our brain chemistry on a molecular level.
It's kind of mind-blowing when you think about it that way. But here's where things get really interesting. It's not just the drug itself that determines how intoxicated you feel, right? I was reading that even the color of the room you're in can impact how a drug affects you.
Oh, yeah, absolutely. That might sound surprising. But individual differences, your environment, even your mindset at the time, all of these can dramatically alter your experience with a drug.
So it's like a recipe. You have the main ingredient, which is the drug. But then a bunch of other factors can spice things up or tone them down.
Exactly. Things like your age, your weight, your metabolism, even how often you use the substance and your overall health, they all play a role.
And let's not forget about your emotional state, right? Like if you're already anxious, taking a stimulant might amplify that anxiety.
Yeah, that's a key point. And think about where you are, the environment, who you're with, even past experiences can all come into play.
It really is a complex interplay of factors, kind of like a personalized cocktail of influences that are shaping your experience. But what happens when this cocktail goes wrong? We're talking about overdoses, right?
Yes, and it's crucial to understand what an overdose actually is. It's when someone consumes a toxic amount of a substance, overwhelming their body's ability to handle it. And this can have a range of consequences, from mild to severe, even death.
And it's not always intentional, right? Some people might accidentally overdose, or maybe there's a contaminated drug supply out there.
You're right, it's not always a deliberate act. Overdoses can be accidental, intentional, or even a result of contaminated drugs, which is a growing concern with the rise of fentanyl.
That's a scary thought, not knowing what's truly in the drugs that you're taking. But regardless of the cause, if you ever witness an overdose, what should you do?
Okay, the most important thing is to act quickly and call 911 immediately. And don't hesitate to call even if you're worried about getting in trouble. Many places have Good Samaritan laws that protect people who report overdoses.
That's good to know. Those laws could potentially save lives. Are there specific things people should do while waiting for first responders?
Absolutely. Staying calm and reassuring the person is key. If you suspect it's an opioid overdose and you have naloxone, also known as Narcan, administer it according to the instructions.
Naloxone, that's the medication that can reverse opioid overdoses, right? But it only works for opioids, right?
Exactly. It's vital to remember that naloxone is specific to opioid overdoses and won't work for other types of overdoses. But in those crucial moments, it can be a lifesaver. And while you're waiting for help to arrive, keep monitoring their breathing and be ready to give detailed information to the emergency services.
It sounds like knowing how to recognize an overdose and respond quickly could make all the difference. So far, we've talked about what happens when drugs enter the body and the risks involved. But how do they actually get into our system? I'm guessing it's more than just swallowing a pill.
Oh, you're absolutely right. There are actually 5 main routes of administration: oral, across mucous membranes, injection, inhalation, and transdermal.
Okay, so let's break those down. Starting with oral administration, that's probably the slowest way to get a drug into your bloodstream, right?
Exactly. Think about swallowing a pill. It has this long journey ahead through your digestive system, getting broken down. And only then can it be absorbed into your bloodstream. It's much slower and can lead to unpredictable absorption depending on various factors.
I can see how that would be a gamble. Like your stomach could be full or empty, you might throw up, or maybe the drug itself causes stomach issues.
All valid points.
So what about a faster route, like those mucous membranes you mentioned?
Okay, so that's the express lane. Mucous membranes, like those in your nose, mouth, gums, and even rectum, are packed with blood vessels. When a drug comes into contact with these membranes, it's absorbed much faster, bypassing that initial breakdown process that happens with oral administration.
That sounds a lot more direct, but I imagine there are downsides to repeatedly exposing those delicate membranes to drugs.
There are definitely risks involved. Think about it, constantly bombarding those sensitive tissues with foreign substances can cause damage over time. For instance, snorting drugs can lead to problems with the nasal septum. And long-term use of things like sublingual medications or suppositories can increase the risk of oral cancers.
So again, a trade-off. Faster absorption, but with potential long-term consequences. Now injection seems even more direct, like you're bypassing the body's natural defenses entirely. Most people probably think of IV injection going straight into a vein.
You're right, 4V injection is probably the most well-known method. It delivers the drug directly into the bloodstream for a fastest and most intense effect. But there are other methods too, like intramuscular and subcutaneous injections, each with its own absorption rate.
It's fascinating how those subtle variations can have such a big impact. But I can only imagine that bypassing those natural barriers comes with its own set of risks.
Absolutely. Injection, while fast, carries a higher risk of overdoses. There's also the potential for infection, especially if you're not using sterile equipment. And repeated injections can damage your veins over time.
It seems there's always a trade-off. What about inhalation? That's the route for things like smoking, right?
Exactly. When you inhale a drug, it enters your lungs, which have this massive surface area designed for absorbing oxygen. But in this case, it's absorbing the drug, which then rapidly enters your bloodstream and travels to your central nervous system.
It's like a superhighway to the brain, which explains why smoking or vaping produces such quick effects. But what are some examples beyond just cigarettes?
You have things like huffing, where people inhale solvents or other volatile substances. And then there's vaporous inhalation, like vaping nicotine or THC.
So lots of ways to inhale, but it sounds like there are some serious downsides to this route as well. Those lungs weren't meant to handle all those chemicals, right?
You got it. Repeated exposure to inhaled drugs can cause all sorts of respiratory problems, from simple irritation to full-blown lung damage. And just like with injection, because inhalation gets the drug into your system so quickly, there's a high risk of overdose, not to mention the potential for addiction.
It's a reminder that even though inhalation might seem less invasive than something like injection, it still comes with its own set of dangers. What about transdermal administration? I'm picturing those nicotine patches.
Yeah, that's a great example. Transdermal administration is all about delivering a drug through the skin, usually via a patch. It's a slow and steady release as the drug diffuses through your skin and enters your bloodstream without having to go through your stomach or lungs.
I can see the appeal. It seems convenient and less invasive. What are some benefits of this route?
Well, that slow, controlled release makes it suitable for certain things like long-term pain management. Plus, it's easy to use, no needles involved, and because it's a gradual release, people tend to stick with it better. No more forgetting to take your pills multiple times a day.
There have to be some downsides though, right?
Of course. Not all substances can be absorbed effectively through the skin. Plus, you might get skin irritation or allergic reactions. And absorption rates can vary depending on things like how thick your skin is or even your body temperature.
So like with everything else, there are pros and cons to consider. It seems like the way a drug enters your body plays a huge role in how it impacts you. Now, I remember you mentioning that there are 4 main categories of psychoactive drugs: depressants, stimulants, hallucinogens, and opioids.
You're right. And understanding these categories is key to unlocking how these drugs work and the different effects they have on your brain and body. And each category has its own unique way of interacting with your brain's intricate communication system.
Okay, so let's delve into these categories one by one, starting with depressants. You mentioned that they work by increasing the activity of GABA, but how does that actually translate into like feeling relaxed or less anxious?
Well, think of GABA, or gamma-aminobutyric acid, as your brain's chill-out chemical. It's the main inhibitory neurotransmitter, essentially acting like a brake pedal, slowing down all that electrical activity in your brain.
So it's like calming those neural storms.
That's a great way to put it. Now, when depressants come into play, they boost GABA's calming effect, leading to feelings of relaxation, drowsiness, and reduced anxiety. That's why medications like Xanax, a type of benzodiazepine, are prescribed for anxiety disorders. And it also explains why that glass of wine at the end of a long day can make you feel more mellow.
But I've heard that too much of a good thing, even with depressants, can be dangerous, right?
Absolutely. Too much of a depressant can be like slamming on the brakes too hard. It can slow down vital functions like breathing and heart rate, potentially leading to coma or even death.
That's a scary thought. And mixing depressants, especially with alcohol, can amplify those risks, right?
It's incredibly dangerous. It's like taking your foot off the gas and slamming on the brakes at the same time. Not a good combination.
So depressants are about slowing things down, but what about their opposite stimulants? They seem to, like, rev up the engine, so to speak.
You got it. Stimulants speed up your central nervous system by increasing the levels of certain neurotransmitters in your brain, primarily dopamine and norepinephrine. These chemicals are associated with pleasure, motivation, alertness, and energy.
So it's like hitting the gas pedal and flooding the brain with those feel-good chemicals.
Exactly. And that surge is what gives stimulants their signature effects.
Yeah.
Increased energy, focus, and that feeling of being up. But it's also what makes them potentially addictive. Your brain starts craving those pleasurable feelings and wants more.
That makes sense. But you mentioned earlier that stimulants can also have beneficial effects. Can you give me some examples?
Absolutely. Take ADHD medications like Ritalin or Adderall, for instance. For people with ADHD, these medications can help improve focus attention and impulse control. It's about finding the right balance, using stimulants strategically to achieve a desired therapeutic effect.
So in those cases, it's less about getting high and more about helping the brain function optimally.
That's a great way to put it. It highlights how the effects of these drugs can vary depending on the individual and the context of their use.
Okay, so we've explored the realms of chilling out and revving up. Now let's venture into the more mind-bending category. Hallucinogens or psychedelics. You mentioned they alter perception and create unique sensations, but how does that actually work in the brain?
Hallucinogens are fascinating because they're a bit more complex than depressants or stimulants. They affect a wider range of neurotransmitters and brain regions, and we're still unraveling all the mysteries of how they work.
So they're playing a different tune altogether, messing with multiple channels in the brain.
You could say that. One of the key players in the hallucinogenic experience is serotonin, a neurotransmitter involved in mood perception and sensory experiences. Many hallucinogens like LSD and psilocybin act on serotonin receptors, particularly a subtype called the 5-HT2A receptor.
And by messing with those receptors, they can create some pretty wild changes in how we experience the world.
Exactly. They can disrupt the normal filtering and processing of sensory information, leading to those altered perceptions, hallucinations, and even synesthesia, where senses get crossed and you might see sounds or hear colors.
That's incredible. No wonder these substances have captivated people's imaginations for centuries. And now there's even a growing interest in their therapeutic potential, right?
Absolutely. Researchers are exploring how substances like psilocybin and MDMA might be used to treat conditions like depression, anxiety, and even PTSD. There's a lot of excitement about their potential to access deeper parts of the mind and help people heal from trauma.
It sounds like there's still a lot to learn, but the possibilities are intriguing.
There's definitely a lot more research to be done, but the early findings are promising. But we can't forget that these substances, like all drugs, also come with risks.
Of course. Any therapeutic use should be carefully controlled and monitored by medical professionals. Okay, let's move on to the last category, opioids. They're powerful painkillers, but also carry a serious risk of addiction. You mentioned they work by binding to opioid receptors in the brain. Can you tell me more about those receptors and what happens when opioids latch onto them?
Opioid receptors are found throughout your brain and body. Their main job is to regulate pain, but they're also involved in pleasure and reward. When opioids bind to these receptors, they essentially block pain signals and trigger the release of dopamine, that feel-good neurotransmitter we talked about earlier.
Ah, dopamine again. So that explains the euphoric effects of opioids,
Yeah.
but it also explains why they're so addictive, right?
You got it. Opioids hijack the brain's reward system, creating this intense sense of pleasure and well-being. But over time, your brain adapts to them, and you need higher and higher doses to achieve the same effect. That's what we call tolerance.
And I imagine that when you stop using opioids after building up a tolerance, that's when withdrawal sets in.
Exactly. Withdrawal happens because your brain has become dependent on the drug to function. When you take away the opioids, it throws your brain into a state of imbalance, leading to all sorts of unpleasant physical and psychological symptoms.
It sounds like a vicious cycle. You used to feel good, build up a tolerance, and then when you try to stop, you feel terrible.
That's the heartbreaking reality of opioid addiction. But it's important to remember that there are effective treatments available. including medications like methadone and Suboxone, which can help manage withdrawal symptoms and cravings, giving people a chance to break free from that cycle.
That's good to know. There's hope for recovery, even though it's a tough road. You mentioned earlier that opioids can be either natural or synthetic. Can you explain the difference?
Of course, natural opioids like morphine and codeine come straight from the source of the opium poppy plant. They've been used for pain relief for centuries.
So they're the OG pain relievers.
Well, you could say that. But as science progressed, we learned how to synthesize opioids in a lab, creating semi-synthetic opioids like heroin and fully synthetic ones like fentanyl.
And I've heard that these synthetic opioids tend to be much stronger.
That's true, and it's one of the reasons they're so dangerous. For example, fentanyl is 50 to 100 times more potent than morphine. This increased potency makes them even more effective at relieving pain, but it also significantly increases the risk of overdoses.
That's terrifying, especially with fentanyl being found in so many counterfeit pills these days.
It's a serious problem. People might think they're taking something like oxycodone, but it could be laced with fentanyl without them even knowing.
So it's like playing Russian roulette with your life. You have no idea what you're actually getting.
That's a stark way to put it, but
Yeah.
unfortunately it's true in many cases.
Okay, we've talked about those broad categories, but can we delve a bit deeper into some specific examples? Let's start with depressants. You mentioned benzodiazepines like Xanax and Valium. What are some other types of depressants and what makes them unique?
Beyond benzodiazepines, you have alcohol, which is probably the most widely used depressant. Even though it's legal and readily available, it's still a powerful drug that acts on multiple neurotransmitter systems in the brain, ultimately enhancing that GABA activity we talked about.
So in a way, it's similar to benzodiazepines in that it promotes relaxation and reduces anxiety. But we all know that alcohol can have some pretty negative consequences, especially when abused. It's a reminder that even legal substances can be dangerous if not used responsibly.
Absolutely. And then you have inhalants, which are a diverse group of volatile substances that people inhale to get high. Things like solvents, glues, paint thinners, and aerosol sprays.
Wait, so people actually get high off those everyday household products?
It's more common than you might think, and it's incredibly dangerous.
Yeah.
Inhaling these chemicals can have serious, even fatal consequences, damaging the brain, lungs, heart, and other organs. It's a stark reminder that any substance, even those you wouldn't typically associate with drug use, can be harmful when misused.
That's a disturbing thought. It's like the danger is lurking in plain sight. Okay, let's shift gears and talk about stimulants. We've already touched on cocaine and ADHD medications, but what about amphetamines? How do they compare to those other stimulants?
Amphetamines are a class of stimulants that include both legal prescription medications like Adderall and illegal substances like methamphetamine. They work similarly to cocaine, increasing dopamine and norepinephrine in the brain, but their effects tend to last longer.
So they provide a more sustained boost, but that probably also makes them more addictive.
You're exactly right. Methamphetamine, for example, can produce a high that lasts for hours, leading to intense cravings and a relentless cycle of use.
And meth is notorious for its devastating effects on both physical and mental health, right?
It's a very destructive drug.
Yeah.
Long-term use can lead to problems like tooth decay, skin sores, paranoia, psychosis, and even death. It's a tragic reminder that chasing those stimulant highs can come at a very steep price.
Absolutely. It's like the allure of the high blinds people to the potential consequences. Now, let's talk about nicotine. It's a stimulant found in tobacco products, but it seems to have its own unique set of effects.
Nicotine is interesting because it's a legal stimulant that's incredibly addictive. It works by activating specific receptors in the brain that are involved in reward and pleasure, triggering the release of dopamine.
So it's hijacking the brain's reward system in a similar way to cocaine and amphetamines, even though the effects are different.
Exactly. Nicotine can increase alertness and focus, but it also has some serious downsides, particularly for your cardiovascular health.
Yeah.
Smoking or vaping nicotine significantly increases your risk of heart disease, stroke, and lung cancer.
It's a powerful reminder that even legal stimulants can have serious consequences if we're not careful. And then there's caffeine, the stimulant we probably encounter most often in our daily lives. How does it compare to other stimulants?
Caffeine is the world's most widely consumed psychoactive drug. Think coffee, tea, chocolate, energy drinks. It works by blocking adenosine receptors in your brain. essentially preventing that sleepy feeling from setting in.
So it's like hitting the snooze button on your brain's natural sleep cycle.
Exactly. And it also increases dopamine, but to a lesser extent than other stimulants. This means caffeine provides a milder and more sustained energy boost without the intense highs and lows of something like cocaine or amphetamines.
But it's still a stimulant, and I've definitely experienced those caffeine withdrawal headaches when I've skipped my morning coffee.
You're right, caffeine can be addictive, although its potential for addiction is generally considered lower than other stimulants. It's all about moderation and being mindful of how your body responds.
Okay, so we've delved into the world of depressants and stimulants. Now let's journey into the realm of hallucinogens or psychedelics, where perception takes a backseat and things get a little more surreal. You mentioned they can create some pretty wild alterations in perception. Can you give me some specific examples of how different hallucinogens affect the brain and body?
One of the most well-known hallucinogens is LSD, or lysergic acid diethylamide. It's a synthetic drug that rose to prominence during the counterculture movement of the 1960s. LSD is famous or infamous for producing profound alterations in perception, mood, and thought.
We're talking about those classic psychedelic experiences, seeing trails of light, feeling connected to everything, maybe even experiencing a sense of ego dissolution.
Exactly. LSD can trigger a wide range of visual and auditory hallucinations, along with distortions of time and space. And it can also induce powerful emotional experiences, both positive and negative.
So it's a bit of a wild card. The effects can be unpredictable.
Absolutely. Set and setting play a huge role. Your mindset and the environment where you take the drug can significantly influence your experience.
That makes sense. It's not just about the drug itself, but the whole context surrounding its use. Now, what about psilocybin mushrooms? They're a natural source of hallucinogens, right?
You're right. Psilocybin mushrooms, often called magic mushrooms, contain psilocybin, which your body converts into psilocin. And psilocin is what triggers those mind-altering effects.
And these mushrooms have a long history of spiritual and ceremonial use, right?
They do. Indigenous cultures around the world have used psilocybin mushrooms for centuries as part of their spiritual practices. And they're becoming increasingly popular in Western culture, too, with a growing movement advocating for their responsible use to address mental health conditions like depression, anxiety, and addiction.
So they're being explored as potential tools for healing and personal growth.
Exactly. But it's crucial to remember that psilocybin mushrooms, like all hallucinogens, can also have adverse effects like anxiety, paranoia, and even psychotic episodes in some people.
Right, so it's not something to be taken lightly. Responsible use and appropriate guidance are essential. What about MDMA? It's often associated with the rave scene, but I've heard it's being studied for its therapeutic potential as well.
MDMA, also known as ecstasy or Molly, is a synthetic drug that's become popular in dance clubs and music festivals. It's known for producing feelings of euphoria, empathy, and a sense of connection with others.
I've heard it called the love drug because it can enhance those feelings of closeness and intimacy.
That's a common nickname, and it reflects how MDMA affects your brain. It increases the release and blocks the reuptake of serotonin, dopamine, and norepinephrine. It's like a triple whammy of neurotransmitters flooding your brain with those feel-good chemicals.
But too much of a good thing can be dangerous, right? What are some risks associated with MDMA use?
MDMA can lead to dehydration, overheating, and hyponatremia, a dangerous condition caused by low sodium levels in the blood. And there's also the potential for psychological problems like anxiety, depression, and even psychosis in some people.
So it's important to use MDMA responsibly and in a safe environment. Are there any other noteworthy hallucinogenic substances that people should be aware of?
There are a few others worth mentioning. One is ketamine, which is actually a dissociative anesthetic used in human and veterinary medicine.
Wait, so it's a legitimate medical drug that's also used recreationally as a hallucinogen?
Exactly. At low doses, ketamine can create hallucinatory effects, including feelings of detachment from reality distortions in time and space, and even out-of-body experiences.
And I've read that it's showing promise as a potential treatment for severe depression.
You're right. There's growing evidence that ketamine can provide rapid and lasting relief from depression, even for people who haven't responded to other treatments. But like all hallucinogens, it's not without risks. It can be addictive, cause bladder damage with long-term use, and has the potential to trigger psychological problems.
So it's a promising tool, but one that needs to be used with caution and under the guidance of medical professionals. What about ayahuasca? You mentioned earlier that it's used in spiritual ceremonies by indigenous cultures.
Ayahuasca is a brew made from plants found in the Amazon rainforest. It contains powerful psychoactive compounds and has been used for centuries in spiritual healing and divination.
And I've heard about these ayahuasca retreats becoming more popular in Western culture, with people seeking those profound experiences for personal growth and healing.
You're right. People are increasingly drawn to ayahuasca as an alternative way to explore their consciousness and connect with something larger than themselves. But it's not a casual experience. Ayahuasca typically produces intense visions and emotions, often accompanied by purging, like vomiting and diarrhea.
It sounds intense. Definitely not something to try without careful preparation and guidance.
Exactly. Ayahuasca is not for the faint of heart and should always be approached with respect and a deep understanding of what you're getting into.
Okay, one last hallucinogen I wanted to ask about is salvia. I've heard of Salvia divinorum being used for its hallucinatory effects. What can you tell me about it?
Salvia divinorum is a plant that contains a potent hallucinogen called salvinorin A. It's actually one of the most potent, naturally occurring hallucinogens we know of.
Wow, so it's strong stuff. How does it compare to other hallucinogens like LSD or psilocybin mushrooms?
Salvia is unique because it produces incredibly intense but short-lived effects. Think distortions in perception, uncontrollable laughter, a sense of detachment from reality, and sometimes even mystical experiences. But here's the catch. Those effects typically last only 5 to 10 minutes.
So it's a very short but potentially overwhelming trip.
Exactly, and because it can be so unpredictable and intense, it's not recommended for inexperienced users.
It seems like a good rule of thumb with any hallucinogen is to approach it with caution and respect. Don't just dive in headfirst without understanding the potential risks and seeking proper guidance.
I couldn't agree more. It's about respecting these substances and understanding their power. Now, we've explored the world of hallucinogens, but let's not forget about the last category we discussed, opioids. You mentioned they're powerful painkillers, but can also be highly addictive. Can you give some specific examples of different opioids and what makes them unique?
Of course. Let's start with morphine. It's a natural opioid derived from the opium poppy plant and has been a staple in pain management for centuries. It's incredibly effective at treating moderate to severe pain and is often used in hospitals after surgery or for chronic pain conditions. But its effectiveness comes with a catch, right? It's also highly addictive.
That's right. Morphine, like all opioids, carries a significant risk of addiction. It's a Schedule II drug, meaning it has a high potential for abuse and is tightly regulated.
And what about heroin? I know it's an illegal opioid that's often associated with addiction and overdoses.
Heroin is a semi-synthetic opioid that's derived from morphine. It's a Schedule I drug, meaning it has a very high potential for abuse and no currently accepted medical use in the United States. Sadly, it's often linked to overdose deaths as it can suppress breathing, particularly when taken in high doses or mixed with other depressants.
So it's a dangerous drug with very serious risks. What about fentanyl? We've heard so much about fentanyl in recent years, particularly in the context of the opioid epidemic. What makes it so dangerous?
Fentanyl is a synthetic opioid that's 50 to 100 times stronger than morphine. It's a Schedule II drug that doctors prescribe for severe pain, like the kind associated with cancer or end-of-life care. But tragically, it's increasingly being manufactured illegally and sold on the black market, often mixed with other drugs or pressed into counterfeit pills.
And that's what's making it so deadly, right? People might think they're taking something else entirely, but it could be laced with fentanyl without them knowing.
Exactly. Even a tiny amount of fentanyl can be lethal. And because it's so potent, it's challenging to dose accurately, which dramatically increases the risk of overdose.
It's a scary situation. You can't always know what you're getting, and the stakes are incredibly high. What about oxycodone? I know it's a prescription opioid that's been widely prescribed for pain, but it's also been a major contributor to the opioid crisis.
You're right. Oxycodone, a Schedule II drug, is a semi-synthetic opioid that's effective for treating moderate to severe pain. But like other opioids, it carries a high risk of misuse, addiction, and overdose. And it's often targeted by counterfeiters who may lace it with fentanyl or other dangerous substances, making it even riskier.
So even when prescribed legally, oxycodone can be a gateway to addiction, and the presence of counterfeit pills makes it even more dangerous. What about hydrocodone? It's often prescribed for pain as well, right?
Hydrocodone is another semi-synthetic opioid similar to oxycodone. It's also a Schedule II drug that doctors prescribe for moderate to severe pain. You might be familiar with it in medications like Vicodin and Lortab, where it's combined with acetaminophen.
And while it can be effective for pain, it also carries that risk of addiction, right?
Absolutely. Hydrocodone, like all opioids, can lead to tolerance, dependence, and addiction. It's crucial to use it only as prescribed by your doctor and to be aware of the warning signs of addiction.
So we've discussed several types of opioids and their potential for both benefit and harm. But beyond the risk of addiction, what are some other potential dangers of opioid use?
Well, as we mentioned earlier, opioids can suppress breathing, especially when taken in high doses or combined with other depressants like alcohol. This can lead to respiratory depression, which is a life-threatening emergency.
So even if someone doesn't intend to overdose, they could still accidentally stop breathing if they take too much of an opioid or mix it with other substances.
That's right. It's crucial to be aware of the signs of respiratory depression, such as slow or shallow breathing, blue lips or fingernails, and loss of consciousness. If you ever see someone experiencing these symptoms, call 911 immediately.
It's a reminder that opioid use is serious business, and knowing the signs of trouble could save someone's life. Are there any other risks associated with opioids that people should be aware of?
Opioid use can have significant consequences for pregnant women and their developing babies. It can lead to miscarriage, premature birth, low birth weight birth defects, and a condition called neonatal abstinence syndrome, NAS, where the baby experiences withdrawal symptoms after birth.
That's heartbreaking. It's a powerful reminder that opioid use doesn't just impact the individual, but also those around them, especially a developing fetus.
Exactly. And it's not just about the immediate risks. Long-term opioid use can have lasting impacts on your health, including chronic constipation, hormonal imbalances, and an increased risk of falls and fractures.
So it's not just about the potential for addiction and overdose, it's about a whole range of potential health consequences that can impact your life in significant ways.
You've hit the nail on the head. And we can't forget about the social and economic impacts of opioid addiction. It can strain relationships, lead to job loss, and contribute to homelessness and crime. It's a complex issue with far-reaching consequences.
It's clear that opioids are potent substances that can be incredibly beneficial for managing pain. But they also carry a significant burden of risk. So what can be done to address this opioid crisis and reduce the harms associated with these drugs?
It feels like we've reached a critical point in this conversation, where we need to talk about solutions.
Yeah, what can we do to prevent opioid addiction and help those who are already struggling?
We need to shift from a purely punitive approach to one that prioritizes harm reduction and treatment.
Harm reduction. That's about minimizing the negative consequences associated with drug use, right? Not necessarily about forcing people to stop using altogether.
Exactly. Harm reduction acknowledges that drug use is a reality, and instead of judging or punishing people, it focuses on keeping them safe and healthy.
What are some examples of harm reduction strategies that have proven effective?
Well, we've already talked about naloxone, which is a literal lifesaver in opioid overdose situations. Making naloxone widely available without a prescription is a huge step in the right direction.
Yeah, it seems like common sense. Give people the tools they need to survive, especially when the risks are so high.
Right. And another harm reduction strategy that's gaining traction is supervised consumption sites, also known as safe injection sites.
Oh, I've heard about those. They're places where people can use drugs under medical supervision, right?
Exactly. These sites provide a clean and safe environment where people can inject drugs without fear of arrest or judgment. There are trained staff on hand who can intervene if something goes wrong, like an overdose.
It sounds controversial, but the research seems to support their effectiveness in reducing overdoses and connecting people with healthcare services.
The data is clear. Supervised consumption sites save lives, and they don't increase crime or drug use in surrounding areas.
It seems like a pragmatic approach, recognizing that some people will use drugs regardless, so let's at least make it as safe as possible. What about drug checking services? I've heard about those too, particularly in the context of fentanyl contamination.
Drug checking services are becoming increasingly important. With the rise of fentanyl in the drug supply, they allow people to test their drugs for fentanyl and other potentially dangerous substances before they use them.
So it's about giving people information so they can make informed decisions.
Exactly. It's all about empowering people with knowledge. If someone knows that their drugs contain fentanyl, they might choose to use less, use more cautiously, or avoid using altogether.
It seems like a simple but powerful way to reduce harm. And then there's education about safer drug use practices. Is that part of harm reduction as well?
Absolutely. Educating people about the risks associated with different drugs, how to minimize those risks, the signs of overdose, and how to respond to all of this is critical.
It's like we were saying earlier, knowledge is power. The more you understand about these substances, the better equipped you are to stay safe.
I completely agree. And beyond harm reduction, we need to prioritize treatment for opioid addiction. This means making treatment accessible and affordable, removing the stigma surrounding addiction, and offering a range of treatment options to meet individual needs.
I've heard about medication-assisted treatment, or MAT, being effective for opioid addiction. Can you explain how that works?
MAT involves using medications like methadone or buprenorphine to help people manage withdrawal symptoms and cravings, allowing them to stabilize their lives and focus on recovery. It's often combined with counseling and behavioral therapies for a comprehensive approach.
So it's not just about replacing one drug with another, it's about using medication as a tool to support the recovery process.
Exactly. MAT can be incredibly effective when combined with other forms of support, and it's important to remember that recovery from opioid addiction is possible. It takes time, effort, and support, but people can and do recover.
That's a message of hope that we need to hear more often. We've covered a lot of ground today, from the fascinating science of intoxication to the complex world of psychoactive drugs and the challenges of addiction.
It's been quite a journey, and it's clear that understanding these substances is more important than ever, given the current opioid crisis and the evolving landscape of drug use.
I completely agree. If listeners want to delve deeper into this topic, we've included a list of resources in the show notes.
Those resources can provide valuable information and support. Whether you're concerned about your own drug use, someone you love, or just want to stay informed about this critical issue, remember, knowledge is power.
Absolutely. Thanks for joining us on this deep dive. Stay curious, stay informed, and stay safe.